All right, let's dive into something really interesting this time. We're talking medical labs and diagnostics, specifically in East Africa. We've gone through a ton of interviews and reports, talking to folks from the CDC and a bunch of private companies.
Yeah, it's a region with a ton of potential, but it's also super complex, which makes it a really interesting area to look at.
Totally. And we're not just talking numbers and market share here. We're going to uncover the human side of things. The surprising stuff that drives decisions, the influence of donor funding, and even the role of those big-name experts.
We'll unpack the whole competitive landscape, see why having a reliable distributor is just as important as having a cutting-edge product, and really understand the impact of organizations like PEPFAR.
PEPFAR, you mean the U.S. President's Emergency Plan for AIDS Relief.
Exactly, they have a huge influence. But, okay, let's set the scene first. We're talking about places like Kenya, Tanzania, Rwanda, Uganda. These economies are growing fast, and you've got this rising middle class who are more and more aware of, well, healthcare and taking care of themselves.
And that's where the medical lab market comes in, right?
Exactly. As people have more money to spend, they're more likely to invest in their health. So naturally, that means a bigger demand for quality healthcare, including, of course, diagnostic tests.
And it's not just a feeling. We're seeing real evidence of this. The interviews painted a clear picture. This market is booming, like seriously booming. We're talking 15–20% growth every year, sometimes even double what the general healthcare sector is seeing.
Wow, that's huge.
Yeah, and one person we talked to from Sysmex even mentioned that in some areas, patients are getting same-day test results now.
That's incredible. Just a few years ago, that was unheard of. It really shows you how much progress is being made.
For sure. But like with anything that grows this quickly, there are bound to be some growing pains, especially when it comes to competition.
Oh, absolutely. The competition is fierce. And one of the biggest things we're seeing is this influx of Chinese manufacturers. They're coming in with equipment that's often way cheaper.
Which, on the surface, sounds like a good thing, right? More affordable options and all that.
Right, but it's not that simple. It raises the question, are they sacrificing quality to offer those lower prices?
Ah, the age-old dilemma. Affordability versus quality. Makes you wonder how buyers are making decisions in this landscape.
And that, my friend, is a fantastic question. And it's exactly what we're going to unpack next.
So we've got this booming market, tons of competition, and this constant tension between affordability and quality. It really makes you think, how are buyers actually making decisions in this environment? What are they prioritizing?
You hit the nail on the head. It's such a good question. And honestly, there isn't one easy answer. One of the most fascinating things we found is this huge difference between the public and private sectors. Their priorities are, well, completely different.
Okay, let's unpack that. Let's start with the public sector.
Yeah.
Those government-funded hospitals and clinics. What's driving their decisions?
Well, in the simplest terms, price is king.
Makes sense, right? Government budgets and all that.
Exactly. But here's where it gets interesting. Our interview showed that sometimes existing relationships are actually more important than the tech specs.
Wait, seriously? So a hospital might choose a supplier they already know, even if someone else has a better product on paper?
It happens. It really speaks to the importance of familiarity and trust, especially in a market where reliability, after-sales support, all that can be a bit unpredictable. And it's not just about the equipment itself either.
You're talking about the whole package, distributors, technicians, making sure everything actually works.
Exactly. Remember how we talked about the whole ecosystem being important? That's especially true in the public sector.
So if you're a company like bioMérieux trying to break into this market, you can't just show up with a fancy product and expect everyone to jump on board.
Nope. They need to build those relationships, show they're in it for the long haul, that they'll be there to provide support. It's not just about making the sale. It's about building trust.
It's kind of like choosing a mechanic. You're probably not going to go with the cheapest option. You're going to go with someone you trust, someone who's been reliable before.
Perfect analogy. And it shows how important it is for companies to think long-term, to focus on building those partnerships.
Makes total sense. Okay, so we've got the public sector where price and relationships are huge. What about private hospitals and clinics? How do they see things?
Well, the private sector is a whole different ballgame. For them, reliability is at the top of the list. Then comes price, then the quality of the results, customer engagement, and finally, brand perception.
So it's like they flip the script completely. They're willing to pay more for a product if it means they can rely on it, that it's going to give them accurate results.
Exactly. Think about it from their perspective. Their reputation is everything. They're competing for patients in a way that public hospitals often aren't.
Yeah, if their equipment is constantly breaking down, or if they get a reputation for inaccurate results, that could be really bad for their business.
For sure. It's all about building that trust with patients, making sure they feel confident in the care they're getting.
Okay, so we have these two distinct groups of dyers, each with their own set of priorities. That must make it really tricky for companies to navigate this market effectively.
Absolutely. It means they can't just have a one-size-fits-all approach. They need to tailor their strategies, their messaging, even their products to meet the specific needs and priorities of each sector. It's a real balancing act, but the companies that get it right, well, they're the ones who are going to thrive in this exciting and rapidly evolving market.
It's like playing chess. You have to anticipate the moves, understand the different players, and adapt your strategy accordingly. Speaking of different players, we can't forget about the influence of donors, right? Especially when we're talking about a region like East Africa.
Oh, absolutely. Donors play a massive role. They wield a lot of power, and understanding their influence is crucial if you want to understand this market. And when we talk about donors in East Africa, there's one name that keeps coming up.
You mean PEPFAR?
Exactly, PEPFAR. The U.S. President's Emergency Plan for AIDS Relief. They've had a huge impact on the healthcare landscape in East Africa, and that includes the medical lab market. But to understand their influence, we need to take a step back and look at the bigger picture.
Right, PEPFAR. I mean, their name kept popping up in those interviews. They're clearly a big deal in this region.
Huge. And their influence on the medical lab market is, well, you can draw a straight line between their funding and the kind of equipment you see in these labs.
Give me an example.
So when PEPFAR was really focused on CD4 testing for HIV, BD, Becton Dickinson, they were like the kings of the market.
Yeah.
But then treatment strategies shifted. Viral load testing became the gold standard, and suddenly Roche is on top.
Fascinating. So it's not enough to just have great tech. You have to understand the bigger picture, where the funding is going, what the priorities are.
Exactly. If you're not paying attention to those shifts, you're going to get left behind. And it's not just the donors calling the shots. We can't forget about those key opinion leaders, the KOLs.
Right, the rock stars of the medical world, those respected doctors and researchers who everyone listens to.
Exactly. A KOL's endorsement can make or break a product, especially in a place like East Africa, where trust and personal recommendations carry a lot of weight.
We saw that with Professor Karyuki, right? He's so passionate about antimicrobial resistance, AMR. And it's clear his advocacy has influenced what equipment hospitals are buying.
Absolutely. Professor Karyuki's work shows how KOLs don't just influence what gets bought, but how it's used, how it's integrated into healthcare overall.
And AMR, that ties into another big topic, quality control and making sure these labs are up to par.
Absolutely crucial. When you're dealing with medical diagnostics, accuracy is everything.
And we saw a bunch of different systems in place, right? You've got the international players like the American College of Pathologists, and then regional ones like Kines in Kenya and SANAS in Tanzania.
And then you have these really interesting new approaches, like SafeCare with their tiered rating system. Imagine being able to check a clinic's quality rating just like you would a restaurant.
Transparency. That could be a game changer, not just for patients, but for pushing labs to improve their standards.
Exactly. Though it's important to remember that not all labs are created equal, and there are still some shady things happening.
We did hear about labs being deliberately sabotaged to push patients toward private facilities.
Unfortunately, it happens, which is why strong regulations and oversight are so important. But beyond the regulatory stuff, there's also this huge need for more efficiency.
Like, it's not just about having the latest, greatest equipment.
Right. It's about optimizing those workflows, managing all that data, making sure labs are running as smoothly and efficiently as possible. It's like having a Ferrari, but not knowing how to drive it.
What a waste. So companies that can offer both great equipment and the know-how to make the whole system work better, they're the ones who really have an edge.
100%. It's about being more than just a vendor. It's about being a true partner, helping build a stronger, more sustainable healthcare system in East Africa.
And that's what makes this market so fascinating. It's a balancing act, finding that sweet spot between affordability, quality, and making a real impact. It's dynamic, it's challenging, and honestly, it's pretty inspiring to see it all unfold.
I couldn't agree more.
Well, on that note, we'll leave you to ponder the possibilities. Thanks for joining us for another deep dive. We'll catch you next time.